Well, welcome to Conference 2021. I want to thank NBOA for allowing us a format to connect with you guys, and we certainly miss seeing everybody and going to all the get-togethers and laughing a little more than we should and drinking a little more than we should. And I bet in 2022 we make up for this. We're going to talk about lessons we've learned through the pandemic and talk about strategies for opening your schools and keeping your students safe and your staff safe and making families feel comfortable being back on campus. Some of you may not be familiar with Building Solutions. I know most of you are. Building Solutions is a 30-year-old firm. In fact, we're celebrating our 30th year this year. We got a number of campaigns and exciting announcements coming in association with that 30 year, and we'll make sure those get out to all of you. We've worked with over 150 schools in 39 states. We are facility technical advisors. We are trusted advocates and chief advisors to schools in matters of real estate, construction, master planning, and facilities maintenance management. We do have a national reach. Over the last 30 years, we've created a valuable benchmarking database, allowing schools to measure themselves against peer institutions and effectively set goals and standards across independent schools for facilities management. Building Solutions serves independent schools in a variety of functions. We loosely categorize those functions like this. We have our assessments group. Most of our NBOA partners start the relationship with Building Solutions through our practice of performing facility audits. Facility audit is a granular look at your facilities and the maintenance of those facilities, the operation behind what it takes to maintain and be good stewards of your facilities. And it creates a bridge and effective communication piece between the facilities department and the business office. And it allows for prioritization of maintenance, tackling deferred maintenance in a systematic and planned manner, and the ability to more accurately predict capital expenditures so that we're not hit with surprises all the time. We also have a group within our firm that acts as project management leaders or owner's rep, construction managers. There are a number of terms across the country that mean the same thing. That service begins in master planning. We've been exposed to thousands of buildings, both in the construction process and through our practice of performing facility audits. We have a good understanding of what works and what doesn't work in the independent school environment, and that can be important in the planning phase, not just to understand the constructability of a building, but the feasibility and maintainability based on your staff and budget on the campus. As project leaders or owners reps in the construction project, we become the keepers of the schedule and stewards of the budget. And it's our job to hold everybody accountable to bringing successful completion to the construction project on time, within the budget parameters, and to deliver a product that serves the purpose of the school. And finally, we have a consulting group within our practice that focuses on operations improvement. This could be things like energy modeling or helping a school that is interested in looking at a net zero budgeting when it comes to energy consumption. You may be interested in obtaining sustainability certifications. Maybe that's an important part of your pedagogy is environmental stewardship, or maybe it's a good marketing piece in your part of the country to have those certifications. We also provide experienced permitting support with different agencies that would require such permits. Many of you may have attended our webinars when we partnered with NBOA over the summer in 2020, talking about our Clean Slate program. Clean Slate was an initiative our company started last year in response to COVID-19 and respiratory health threats in general. We were guided by our Respiratory Health Advisory Council, made up of healthcare professionals, mechanical engineering, plumbing consultants, heating and air conditioning specialists, infectious disease experts. And we came up with a program where schools could evaluate their plan for operating during the pandemic, identify gaps in their plan and what is being established as best practices, and also assist in the implementation of those best practices. To support our Clean Slate initiative, we created a dedicated landing page on our website. You can see here at buildingsolns.com/clean slate, where we have vetted articles that are useful for schools when it comes to making decisions about their best practices and what best suits their school in safely operating during this pandemic. Spoke about our Respiratory Health Advisory Council. We formed that council early on so that we didn't just get buried in articles and proclaim ourselves infectious disease experts. We wanted all of our clients to have the full weight of partnering with a 30-year-old established trusted firm like Building Solutions, but we likewise wanted to be supported by qualified and skilled and informed professionals so that we could support the information we were giving to schools. We provided an initial school preparedness review as part of the Clean Slate program. Those preparedness reviews are basically a report card where we compare you to peer schools in your area based on the current level of infection and infection rates in your area, and we give you a report card. We give you a grade and let you know how you stack up and being ready to operate with these epidemic conditions in place. We hosted a number of webinars. We partnered with NBOA several times doing that. We hosted some on our own as well. And we thank all of you that attended for the attendance. It was overwhelming last year. We continue to provide communication on COVID-19 updates through our email periodical that most of you are probably receiving called the COVID Times. It is current and up to date and always filled with great information from Bill Dillard here, who runs our marketing department. Throughout the pandemic, we learned that some of these responses we were doing were going to be temporary, and then there were going to be the long-term responses that become part of our new normal. Temporary responses to the respiratory health threat posed by COVID-19 were things like temperature checks, which we know now aren't effective. You can be completely asymptomatic and be highly contagious with something like COVID-19. Supply chain constraints. Since the mobilization of the Defense Act, the Wartime Defense Act, production is now keeping up with demand. Social distancing, I think we've seen where we need to be vigilant about social distancing and in what areas we've allowed for some leniency in that. I would point to athletic events, fine arts being able to restart in some parts of the country, and masks. I think you'll see masks for a long time in confined spaces, and you'll see people wearing them indoors for a long time. But the effectiveness of the vaccine is probably pointing us into a direction where the full-time wearing of masks is probably going to be a temporary response. So what are our permanent changes? Anytime we have something like this that happens in the world, we have responses that stick. I know that 20 years ago, if you had told me I wouldn't be able to just hop on an airplane with my McDonald's in my hand and eat my hamburger on the airplane and be in Houston in 45 minutes, I would have said you're nuts. But 9/11 happened, and we had the increase in airport security. And I think we all thought that was going to be temporary. But here we are 20 plus years later, and we still take off our belts and our shoes, and we don't take food through the security checkpoints, and we don't take shampoo in our bags anymore. And this is our new normal. I have a third grader at an independent school here in Dallas, and he comes home and talks about lockdown drills the same way I used to talk about tornado drills or a fire drill. It's part of his new normal in response to school shootings. So we're more flexible than we give ourselves credit for in adapting to new normals. And what we see as far as permanent changes coming out of the COVID-19 pandemic is going to be how we design our heating and air conditioning systems as it pertains to ventilation, filtration, and indoor air quality. The Clean Air program offered by Building Solutions is our response to what we see as being a permanent response to respiratory health threats like COVID-19. You guys, schools, have been asking us for a year, where do we spend our money? Where do we get the most bang for our buck? And we believe and we feel adequately supported by a number of standard bearing institutions that indoor air quality and raising the indoor air quality, increasing the amount of outside air and ventilation is the best thing that a school can do to mitigate the spread of respiratory health threats. The idea that indoor air quality is our best weapon in mitigating respiratory health threats is not new. In fact, in January, President Biden released his national strategy for the COVID-19 response, and there's an entire section dedicated to safely reopening schools, and one of the things he is focusing on is improving ventilation. The American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE, teamed with the Center for Disease Control, and they released reopening guidelines for schools. And the two things that they are recommending we focus on are increase the percentage of outdoor air inside the buildings and increase the ventilation rates. For years, we have designed our heating and air conditioning systems for comfort and efficiency. And the paradigm shift that is coming, and it is going to stick and be part of our new normal with response to COVID-19 and other respiratory health threats, is going to be that we now design these systems around health and safety. I would invite you to think back to the last time you were in a hospital and felt comfortable. Those indoor air quality settings in a hospital are not designed with your comfort in mind. They are designed to mitigate the spread of airborne diseases. In 1972, ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, created a standard. That standard is 62.1. ASHRAE's standards are frequently adopted by federal, state, and municipal agencies to become building code. So this is a standard-bearing organization, and they created 62.1 in response to optimal indoor air quality. 62.1 is the basis of Building Solutions' Clean Air program. It is our North Star, it is our guiding light, and it is founded in science and supported by the industry leader in HVAC and indoor air quality. The Clean Air program that Building Solutions created in response to respiratory health threats really takes the standard 62.1 identified by ASHRAE and uses that as our guiding light and as our North Star in helping schools identify their roadmap to optimal indoor air quality. The use of exotic technologies like bipolar ionization or UV light treatments or air scrubbers or increased filtrations are all excellent tools in controlling or helping to control respiratory health threats. But unless your system is performing at an optimal level, those technologies can actually do catastrophic harm to your HVAC system. And the items that are checked and referenced in ASHRAE standard 62.1 are far above scope of any preventative maintenance program you would be having, or anything that an air conditioning contractor would routinely check before installing these technologies. Again, this is a new paradigm. This is a new way of thinking. The Clean Air program is designed to review your systems and then provide a blueprint for your air conditioning contractor to follow that will give you this optimum indoor air quality. Now, whatever technologies you employ on top of this will have the maximum effect on helping mitigate respiratory health threats. So Is it feasible that every school, every independent school could take the standard 62.1 and upgrade their HVAC systems to meet that standard? Absolutely not. Time and money would be prohibitive. Now, is it feasible that we use that as a guideline and take the things that are identified as deficient and identify those that help us control respiratory health threats and address those as priorities? Of course. So we look at the Clean Air program as a what should I do, what could I do, and what can I do? And then we'll create this roadmap, and it gives a guiding light for the school for future plans, for capital plans. So initially, the report will identify low-hanging fruit that typically we can handle in-house with our existing facilities team and address some issues. Then we'll have this next level of expenditures, which aren't capital expenditures, but maybe several $1,000s worth of repairs, upgrades that need to be done to systems. Then if we have systems that are antiquated or have too much deferred maintenance and they are going to be a capital expense, we'll list those separately. But the goal of the program is to provide this blueprint to the school, to heating and air conditioning contractors, and to the facilities team on how to redesign and reimagine our systems to give us optimum indoor air quality to control the spread of COVID-19. We understand that this is not visible to families, to teachers, to students. We encourage schools to continue with those optics, taking temperatures, utilizing technology where you can log your temperature and how you're feeling questionnaires on different app-based technologies. But as far as what keeps us the safest, this is the safest. We understand it'll be important to communicate that with your constituency. One of the pieces that comes along with the Clean Air program is communication that you can send to your staff, your families, your students that identifies what you're doing as a part of this Clean Air program to mitigate respiratory health threats, that you're partnering with a 30-year-old firm like Building Solutions who's been serving independent schools, and that we are further supported by our Respiratory Health Advisory Council. It's an effective tool. We've had a number of schools already begin implementing the program, and we look forward to helping everybody open safely, and let's get back to pep rallies and sporting events and choir concerts and band recitals and musicals and big loud lunchrooms and all the things that make school school. To start the process of getting your school a clean slate review, we have a short survey. If you contact myself or Bill Dillard at our email addresses here or via telephone, we'll be happy to send you a link for the survey. Shouldn't take more than 5 or 10 minutes to fill out. And then it'll take us just a few days to turn around a proposal to perform the clean air review at your school. And the result of the clean air review would be your blueprint or roadmap to success. So we look forward to working with all of you. Certainly miss seeing everybody this year at the conference, and we look forward to next year when we can all be together and high five that we survived this pandemic. So thanks a lot for your time. We appreciate you.